Suffice it to say, we are all in agreement that mitigation measures need to be stepped up significantly and immediately here and around the country. I will remind you that this time last week we had just announced our first positive case of COVID-19. As of this briefing, we now have 136 cases, 22 new cases since our morning update. One of those new cases is in Ascension Parish, the first in the capital region of the state. And sadly, just moments ago, we had our third death, an 84-year-old from Lambeth House in Orleans Parish. And yes, it is still true that the majority of cases are in New Orleans. The number there is currently at 94, 12 cases at the Lambeth House. But to be clear, we have positive cases now across the state. And no one should have a false sense of security when they look at the list of parishes and see which ones have and do not have positive cases. And that is because I suspect, and we have been told, that as we more aggressively test around the state of Louisiana, we will confirm more cases of COVID-19. Further, the cases that are being tested positive today, those exposures likely happened 4, 5, 6, 7 days ago. So even if we are 100% effective in our mitigation efforts today, we are still going to see a rise in cases going into the future. But the fact of the matter is, the best we can hope for from our mitigation measures is a slowdown of the transmission, not that we will be able to stop all transmissions. So if your community has not yet been named, it doesn't mean that the virus isn't present, and it certainly doesn't mean that no one has been tested. It is likely a matter of time before there is a case in your area. And I want everyone to understand that so that when it happens, you are not surprised. The Louisiana Department of Health has confirmed substantial community spread in Louisiana. And it is also true that on a per capita basis, we have one of the highest rates of COVID-19 spread, positive cases in the country. And what concerns me is the healthcare delivery system is sized to meet the needs of a given population. And so having one of the highest per capita number of cases of COVID in the country means that we are at risk for exceeding the ability that we have to deliver health care if we don't slow the transmission and extend the duration of this event. So I cannot stress enough that this is a very serious situation that demands an equally serious response and a prompt response. And that is why we have implemented important statewide measures. When we look at what has worked in stopping the spread of COVID-19 in other countries, it is protective actions that create social distance, because we know the virus spreads easily and swiftly. And in addition to the distance that you have to keep from other individuals, you also have to be mindful that the virus can live on surfaces for some period of time that can extend out several days. So what are we going to do? Tonight, beginning at midnight, we're going to further limit the size of gatherings to fewer than 50 people. We're closing casinos, bars, movie theaters, gyms, and fitness centers, and we're going to limit restaurants to takeout, delivery, and drive-through orders only. And we thank the Restaurant Association in advance for doing the work that they have done and will continue to do with our restaurants. These changes are statewide. At this time, the plan is for operations to resume on April the 13th. However, we will reevaluate the situation a week before, or in the weeks before that, to determine whether these need to be extended. And certainly at all times, we will be looking for additional mitigation measures that might have to be implemented.